and happy to see a full house and to see that we have got here. Just 1 year ago, we launched the platform, and only some months later, we're really walking the talk. We will be signing shortly a first contribution to this important platform, which is very relevant because of 3, maybe 4 main reasons. First, because we're talking about health, and investing in health is the best saving that one can make. I don't have to explain it to health ministers around the table. Prevention is so much more valuable than having to then pay and cure and heal the weaknesses of the system. Primary health, and Dr. Tedros is very passionate about it, so I'm sure he's going to elaborate on that. Primary health is really the basis of the system. It's the heart of our resilience, and this platform is going to make a difference in that area. Investing in health, investing in stronger societies, investing in a better future for all of us. The second reason is that it is an innovative approach, because we will have a platform. We launched it together with the World Health Organization. The European Investment Bank is probably the largest multilateral financial institution in the world when we attend to the balance sheet, but we do 90% of our investments within the EU, as you know. So only 10% of our investments are outside the boundaries of the European Union, but that still means around 8 or 9 billion euros a year. So what we want is to focus on impact. Make sure that we deliver the maximum impact with those investments. And I consider our partnership with the WHO one of the most impactful manners in which we can change the world through our investment actions outside the EU. And in particular, having a platform, launching a platform which very soon thereafter is already gathering the African Development Bank, represented here. The Asian Development Bank, I understand, is also committing and pledging to join. And I'm sure that others will join, which is really a sign of success, because together we're stronger to face these common challenges. The third reason that I'm quite satisfied is that we're going to engage very actively with the countries. It is the countries that have to design their programs. They have to define their priorities, because they are the ones which are on the ground and they know what their needs are of their people. Finally, and that's the fourth reason why I'm quite inspired and happy to be able to participate, is that if we succeed, and we will, this can be a blueprint for us to try to address other global challenges. When we are talking about climate, we're talking about health, we're talking about social infrastructures, we're talking about gender equality, we're talking about peace. At the end of the day, we know that together, we need to get together to cope with all these challenges. And having these platforms and these blueprints, these examples, can help us probably extend this cooperation beyond and make a larger difference in other areas too. So thanks for the opportunity, thanks for joining us, and I'll then pass, I don't know if you want to pose a different question maybe to Dr. Tedros, otherwise I'm sure he will complement what I just said with the same passion and determination. Thank you.
Thank you, President Calvino. I will ask a little bit of a difficult question, not a difficult, a different. Dr. Tedros, this comes in the context also, as I mentioned earlier, of the WHO's investment round as well. Just to remind people, what we're announcing today is the launch of the first investment plans, also the first contribution from the EIB. But as well, the endorsement from the Asian Development Bank. I would say as well that the Islamic Development Bank was also one of those founder members back in Paris when we launched. How does that fit in with and the progress that has been achieved with the WHO round?
No, thank you so much. I fully agree, by the way, with what Madam President said. I fully agree, and I endorse. But I thought I was going to answer the same question, but I'm glad you asked a different one, which is the investment round especially is very important for us. This platform is very important for the investment round. As you know, we're aiming to mobilize $1.5 billion. And this funding will go to countries to support them based on their priorities. As the President said, that makes it, by the way, unique, because from the first 5 countries, that's exactly what happened the finance was provided to countries to address their gaps based on their own assessment and to help them with their priorities, because they know better, with regard to what problems they have and what gaps and so on. So investment in primary health care is very relevant in our investment round, because the investment round is to finance the GPW 14. This is like a strategic plan, global health, global agenda. And primary health care is one of the 6 pillars actually in that strategic plan, the 5 years plan. So it's very, very relevant, and will help us, this partnership, to really finance one of the major pillars in the strategic plan. This plan was developed in partnership with our member states, and many partners were also involved, consulted, and it was done through a very consultative process, and that's why the primary health care was identified. So not only it's relevant for our investment round, but this is something that the member states actually have identified as a priority. So that's why we're very, very happy, and this is a significant support, and we hope it will make the investment round a success. But there is one thing I would like to add with regard to investment round, because ministers from Africa are also here. The first investment pledging actually event was in Brazzaville recently on the margins of the regional committee. And countries from Africa and philanthropists have pledged actually $45 million in that regional committee meeting. And what the developing countries are saying is, we will put our resources as well. And funding WHO is also part of our responsibility. And we will support for the success of the investment round by putting the resources from our side as well. And that shows clear ownership by the countries. And I would like to, so from that regional committee meeting in Afro, and now to this launching, I can see that the investment round is getting traction. And I would like to thank all the banks around today for this very innovative financing. And I fully agree with my sister that not only for health, we can use this for many other issues.
Absolutely,
as well.
and it does speak to what is being asked for here at the Summit for the Future, which is an innovative approach to financing, particularly from the multilateral development banks working with the UN agencies. And maybe I can ask you to maybe expand on that point, Beth. I know that your president, Adesina from the African Development Bank, is not able to be here, but delighted that you are to speak on his behalf, Beth Dunford. I mean, the African Development Bank, which of course was one of the founding members of this platform, has been very active in promoting primary health care across the continent. But how specifically do you think this platform is going to help you to deliver that in a more strategic, impactful way?
Well, thank you very much for the question and the introduction, and it's my pleasure to represent African Development Bank Group President Dr. Akinwumi Adesina, who couldn't be here today, but again, investment in health, investment in primary health care is one of his key priorities, and he really wanted me to be here to speak on his behalf. And so we were, very proud to be part of the original group with our European Investment Bank, Islamic Development Bank, World Health Organization to launch the Health Impact Investment Forum and this platform to really earmark and make available more than $1 billion in concessional loans and grants to middle-income countries, and more importantly, to expand the reach and the scope of primary healthcare services. And so I just want to, take us back for a minute. Right now, we're seeing that in Africa, poor health undermines economic productivity across all sectors and has been estimated to cost the continent $2.4 trillion annually. And with countries rebuilding after COVID-19, we have to fund public health services properly. We have to strengthen overall health system resilience, health security, and health systems have to be better secured to equip and prevent outbreaks such as what we're seeing right now with the Mpox. So it seems that 10 million people need to be vaccinated by February next year. And we only see vaccines being available right now in DRC and Nigeria, minimal amounts. So again, our health systems have to be well-funded, have to be better prepared to deal with, outbreaks to come, one of which is facing us right now, and we're not there. And again, so we've seen a lot of finance come to the table, but it's not enough, and it's a very difficult funding environment. So this platform is really helping us leverage the financing that we offer, coming together with others to make it go farther and really impact the long-term sustainability that we need with health systems. So at the African Development Bank, we're seeking to invest $3 billion in Africa's health sector through our strategy for quality health infrastructure in Africa, and also $3 billion to the bank's pharmaceutical action plan. And so over the past 2 years, we've invested close to $545 million towards strengthening health infrastructure in almost 10 countries through loans, debt, equity, investments to private sector, and for examples. But what we need really is to have countries and private sector and partners come together to prioritize investment in health, prioritize investment in primary health care, so we can do more together. So again, we're really excited to be here as part of the founding members of this platform, to see it scale up, to see the implementation happen on the ground. With globally minded health impact investment platform, we can change the course of these challenges for positive impact.
Thank you so much, and thank you for laying out a little bit in detail what that platform could actually be doing and its value. And I'm very happy to bring Axel von Trotzenberg in here on this. I mean, the World Bank is obviously not part of the platform, but of course, we have a huge amount to share together about our experience and the experience of the World Bank in financing primary health care. But I want to ask you a little bit about how you see the role of the WHO there too, with that emphasis in the investment round on the innovative financing platforms like this. How important do you think that is? Where do you think the challenges are that need to be addressed? Can you give us your perspective?
Thank you, and good afternoon. And let me thank you, Nadia, as well, Tedros, for convening. I think we need to keep a laser-sharp focus on health. The fact is that 4.5 billion people are not covered by health coverage. And 2 billion are severely challenged to have this. And so we have a collective challenge, whether that is governments, whether it's the private sector, whether it's the multilateral community. And so it is only desirable that we are looking at different ways to collaborate with each other. But I think we need never to lose sight of what the challenge is, and that we need to stay involved in it. There are also other challenges, but that is where we collectively need to stay focused. It's also important that to do that with the UN, I would say, Tedros probably will agree, that we have learned a lot together with COVID. And there is no alternative to collaborate and to complement each other's comparative advantages. You have a lot on the substance, you know where it is, and then how can you as a multilateral development bank complement this effort? And I think that is where we need to go further. I think that in the business model of the bank over the last couple of years, we have really developed new operational relationship. WHO is not all you go to a conference and you exchange politely. Here is an operational relationship. Same with UNICEF, same with WFP, to name a few, UNHCR, other examples. So that is good, and that will need to be done. We have also set goals in that we said we would like to, together with the WHO, reach at least 1.5 billion people to have good health service by 2030. If we can accelerate, let's do that by all means and see what we can do. So, and the environment is difficult. And the affected countries have, of course, had devastating impact with COVID. The rich countries were able to have large programs in place to help their populations to the tune of 12-13% of GDP. Middle-income countries had 6%. The low incomes had 2%. And many were left behind as a result in the health education area. So what you are seeing right now is actually that there is maybe a deprioritization. Let's not forget that we need to get back from deprioritization to prioritization. And that requires to look at what governments themselves can do, how you improve the efficiency, but also what the private sector can do, and what the multilateral world can do. And here we need to do more. Again, there are challenges because many, and we see that with the IDA replenishment talks, many countries are suffering from enormous fiscal stress, so there are very hard trade-off decisions to be made, and that is the operating environment in which we. So therefore, cooperation means more than ever, namely how we can actually leverage each other's advantages. As Nadia, for example, said, that actually the EIB is basically focused on Europe. That is the mandate. Now, to go outside of it is, what are then the advantages to see how you can complement? And I think there are a lot of areas of cooperation. We have a active portfolio of 36 billion in the health area, and we are committing a couple of billions dollars every year in this area. That sounds great, but it is not enough. And so the only way to be successful is how everybody collectively can do this. And there comes, again, we had meetings yesterday with the MDBs, how to work better as a system, how can we complement that. That can be with easier procurement, can be also, say, on coordination, co-financing. There are lots of things. We should basically be very open to all these options, and actually always say that when we meet, can we actually report a little progress? So I think as long as we keep that focus on this, that at the end, and you mentioned that impact and result is the only thing with that then the instrument to achieve that, including financing, are critical. That should be mentioned, but we should work towards that. I think we can make a lot more progress. And I also think that therefore, this initiative is an important one because it tries to keep this front and center of our concerns and I think our responsibilities. Thank you.
Thank you very much for that, Axel von Trotzenberg, and thank you for your endorsement of the platform as well, and giving us that wider perspective of what's been going on here in New York as well, in terms of the very substantial progress between the multilateral development banks and the UN agencies, which is underpinning all of this. Now, we're going to move to a very important part of our roundtable now, which is to hear from the countries themselves. Around 15 countries are now about to embark on their new investment plans under this platform. 5 are well ahead. We're delighted to have with us the ministers both from Senegal and from Uganda, and also from Belgium, to give us a perspective on the national approach. I have to say, I'm very sorry, Monsieur Ministre, qu'on n'a pas d'interprétation, mais on va se débrouiller. We're going to manage, you and me together. And then I will go to Uganda and then invite Heidi from Belgium. Je vais vous poser la question en français, and then I'm going to translate it into English so that we can all understand. Le Sénégal était vraiment une modèle pour le reste du monde à travers particulièrement la réponse à COVID-19. Et c'est pour ça qu'on a fait une coopération très précieuse. Et c'est pour ça que vous êtes vraiment en avant avec cette plateforme et une des pays qui est vraiment qui nous montre un peu ce qu'on peut faire au terrain. Mais je voulais vous poser la question, comment est-ce que cette plateforme peut-elle soutenir davantage les priorités nationales du Sénégal? So what I basically asked is, how can the platform, and I'm going to ask you the same from Uganda, how can the platform underpin and support national priorities? Senegal has been particularly up and forward in what it's done, particularly after COVID, with the Institut Pasteur, the work on local manufacture of vaccinations. So, monsieur, à vous, et je vais un peu traduire après quelques minutes.
Merci beaucoup. Je me permets de prononcer juste quelques mots au nom de son Excellence, le Président de la République du Sénégal. Et comme vous l'avez indiqué, le Sénégal a été quand même un modèle par rapport au financement du secteur de la santé, surtout dans le cadre de la riposte Covid. Parce que nous avons pu quand même combiner différentes sources de financement. Parce qu'on a le budget national qui est là, mais nous avons aussi la contribution du secteur privé, parce qu'on a beaucoup de PPP, mais surtout pour construire des projets d'hôpitaux, de tout ce qui est centre santé, mais on a aussi tout ce qui est la RSE pour soutenir surtout tout ce qui est soins de santé primaire.
I'm just going to stop you there just to share with those who aren't necessarily following. But I think the really key, if I may say, of the points you've just made is the involvement of the private sector in what you've managed to do. You've pulled together different forms of financing, and this is the key, you know, the nut we all have to crack is how to get the private sector involved in these kinds of challenges. So, back to you.
Il y a aussi la participation des collectivités territoriales, surtout pour prendre en charge des besoins de santé au niveau local, mais nous avons aussi la contribution des populations elles-mêmes, parce que les prestations de santé qu'on a au niveau du pays, qu'on a au niveau des structures, sont aussi en partie supportées par les populations elles-mêmes.
So that regional part of it is hugely important as well. Yeah.
Et maintenant, nous sommes en train d'envisager comment, dans le cadre de la couverture sanitaire universelle, accroître le financement du secteur de la santé, en essayant de voir comment mettre en place une stratégie de financement innovant qui passe par des taxes sur les produits pétroliers, qui par les taxes sur les produits de télécommunication, qui passe par les taxes sur tout ce qui est tabac, mais aussi l'exploitation des ressources naturelles de manière globale.
So that's really interesting. So looking at an innovative financing system that could use taxes from areas like oil and also tobacco and actually put them into health financing.
Et on a aussi l'ambition d'intensifier tout ce qui est financement à provenance de la RSE, parce qu'on voit qu'il y a beaucoup d'argent qui existe au niveau domestique avec les entreprises, mais ce n'est pas connu et ça n'a pas été exploité à bon escient par rapport au secteur
so
de la santé.
many sources of financing that are not exploited to date.
Maintenant, on est en train aussi de voir comment mettre en place au niveau du ministère de la Santé une delivery unit. Et cette delivery unit va essayer de voir comment aider les différents programmes, les différents projets, mais aussi les différentes directions à mobiliser davantage de l'argent. Parce qu'on sait qu'on a des projets, des programmes, des directions avec des ressources humaines qui peuvent être limitées. Mais si on a la possibilité d'avoir des experts de très haut niveau qui sont là à faire du fundraising, ça va booster un peu le financement du secteur de la santé et dépendre moins de ressources.
So in a sense, building a kind of platform domestically that delivers, a delivery unit,
yes.
that pulls together what can be a fragmented approach nationally. Et de quelle façon est-ce que vous pensez que cette plateforme peut vous aider à faire tout ce que vous avez décrit? To what extent can the platform help you do this?
En fait, cette plateforme va nous aider à mettre en œuvre un outil qu'on appelle le compact au niveau du Sénégal. Donc le compact, c'est un document que nous avons développé sur les priorités nationales en matière de santé et que les partenaires au développement sont chargés de financer en fonction de leur domaine d'intérêt et pour qu'on puisse avoir une cohérence par rapport à la vue d'ensemble, mais qu'on puisse rationaliser et optimiser les ressources financières dont on a pour que les investissements vont là où ils doivent aller et pour qu'on puisse aussi avoir plus d'impact dans le secteur de la santé.
So basically, it is going to help you to deliver this tool that you call the compact, which is going to be. I mean, you already have a sense of how this platform can connect with your national priorities and that particular tool, right?
Oui. Et je pense que nous pouvons quand même nous réjouir par rapport à l'apport de l'OMS au niveau avec cette plateforme-là, parce qu'elle va vraiment nous aider à encore mieux réorienter nos investissements en fonction de nos priorités et à aussi voir comment mobiliser davantage de ressources. Et à ce titre, le Sénégal s'est engagé aussi à contribuer au financement du programme d'investissement de l'OMS, et on l'a fait lors du dernier comité régional à Brazzaville.
Merci beaucoup, Ministre, pour cette intervention. And I think I want to really underline that last point, that the involvement of WHO is critical here in terms of making sure and helping to guide the investments. And I think that's something that we'll hear a lot, that is the value of the partnership. The MDB, the countries, and of course the WHO underpinning all of that thinking. Thank you, merci beaucoup. I wonder if I can turn to you, Jane Aseng, who you're the Minister of Health for the Republic of Uganda. Can you give us a sense of how this platform could also be helping you to deliver your national priorities on health?
Thank you very much. I hope I can be heard. And allow me, first of all, to congratulate you for coming up with this very important platform, the Health Impact Investment Platform. Of course, we have had several initiatives, global health initiatives that have supported countries, and they have either done so directly or with a lot of support from WHO, and we really appreciate that because it has helped strengthen country initiatives. With this new HIIP, I think there is more need for coordination and consolidation of efforts, especially towards one country, one plan, one monitoring and evaluation, bringing on board all actors within the country and outside the country that help towards access of these funds. And when I talk about all actors, I am including partners within the country, the civil society, the private sector, the community-based organizations need to participate. We would appreciate more transparency and less processes and burdens in accessing these funds. Usually the processes that lead to access of funds take months, take years, lots of negotiations, lots of paperwork, which is unnecessary, especially when you are, geared towards addressing an outbreak like an epidemic. If you're to go through all those processes, it no longer makes a lot of sense. The third one is the aspect of ensuring accountability for resources, transparent accountability, timely accountability, not only from the recipient countries, but both ways. Because usually what we notice is that accountability is only one way. It should actually be both ways. And everybody should be made to be aware about what these resources are doing. And then, of course, one of the important tools is to ensure that we strengthen primary health care, because all our issues are actually based at the primary health care level. Whether it comes to disease outbreaks, whether it comes to poor health access, everything is at the primary health care level. And our diseases start there and end there. So we need to look at the aspect of strengthening community health workers, strengthening primary health care facilities, ensuring that we address the social determinants of health, strengthening health education and promotion, and moving systematically towards universal health coverage. I thank you.
Thank you very much, Minister, for that. Very important points there, and very instructive, I think, for those listening as we embark on the really operational phase of this platform. I'm very happy now to bring in Heidi Rombouts, who is the Deputy Minister from the Belgian government in charge of development cooperation and humanitarian affairs. Heidi, maybe I can sort of take you a step back as well and ask you a question around how do you see the challenges in terms of the financing of global health? Where do we need to focus efforts on this platform? And how, it's a two-pronged question, and I'm going to ask you to answer it quite concisely as well. But how does a sustainably, fully financed WHO also fit into that?
For that question and for having us around the table. And a two-pronged question, let me try to answer in 3 points. First of all, how do we look at health and at global health? Belgium held the EU presidency for the first months of 2024. And we decided actually to bring global health high on the EU agenda, very much from a mutual beneficial partnership. And we were very happy also to partner with WHO. EIB was on the conversation as well, and many of the member states. And we actually defined actually an offer also in Addis Ababa towards the African CDC. How can we foster a true partnership between African Union and European Union? Very much also building on the plans, and I want to thank both ministers for bringing that out, the importance of the national plans. Je voudrais vous remercier, Monsieur le ministre du Sénégal, effectivement aussi pour le partenariat qu'on a au Sénégal avec la Belgique. I will briefly outline, for example, in Senegal, Belgium is also working with Senegal on the regulatory framework. We do that with our bilateral cooperation, but we then also provide funding to WHO to actually assess the regulatory mechanisms. And so this is where things have to go hand in hand. But I want to underscore under the national leadership and ownership of the countries that we work in. And I think that fully coincides also with the African CDC plans on universal health and health coverage and the importance indeed of building the local systems. So that's my first point. The second point, I think you bring it indeed to the funding. There's on the one hand the need for finances, and on the other hand, I think I would like to underscore the quality of funding. I think we all face a similar challenge. The crises are very high, the needs are very high, and the funds, especially the public means, are limited. How do we face that conundrum? And I think that this is exactly where this platform aims to position itself. So thank you also for that initiative. When we look at a notion such as innovative finance, I think innovative finance has been in many of the international conversations right now. And what we probably have to have the courage also to look at is what quality funding can we bring on board. Quality funding remains very important. For us, that is also translated, for example, in core funding to WHO. But what we see as a risk, as a potential risk, and this is not to say that it is a risk for this platform per se, but I think as it positions itself in the financing world and the idea of trying to mobilize more finances, is the fragmentation. I think we really have collectively, we have a responsibility probably to reduce the fragmentation. And I think, Minister of Uganda, you pointed it out very correctly. It has to be easier. Sometimes it is very complex. And there is a tendency also that when we see a problem, we create a fund as a solution. But this is not a solution. Solutions need to be integrated in the national systems. And so I think this is a call upon a collective responsibility to look at quality funding, to look at how funds can be accessed, how that can be made easier, and how we can push back on the fragmentation. The final point is also, I think, as communities, sometimes we forget what we have learned. And it ties back to many of us probably looking at the average age, let's say, in the room. Many of us know probably the Paris Declaration. Ownership, national ownership, was very high on that agenda. And I think sometimes it has been pulled down on the agenda. And I think this is really very important to bring it back high on the agenda. When we talk about country platforms, what is the ownership and the leadership there for the national countries and the authorities to actually take their responsibility also in the wider picture? Thank you.
Thank you so much, Minister. And I'm going to move fast on to the next phase. And you set us up very nicely by talking about the importance of the country platform. That is something that's featured very highly in discussions this week among the multilateral development banks and the way that they might do things more effectively. So I'm going to turn to some of their representatives. Do we have Jordan? Yes, Jordan, you're down there. Schwartz from the Inter-American Development Bank, also Thomas Ostros from the EIB. We've heard from Beth earlier, but I think she had to run away. And we have Fatima Yasmin from the Asian Development Bank there, right? And also Isa Faye from the Islamic Development Bank. Isa, where are you? Right, there you are. Lovely. So I'm going to kick off with you, Jordan. I know that you have a sort of parallel platform in a way called the Complementary Alliance for the Americas, primary healthcare in the Americas. I want to ask you, though, a little bit about actually this concept of the country platform and how you think these initiatives, yours, also the one we're talking about today, really will enhance your ability, our ability as the MDB community to get the money where it needs to go with the countries absolutely as partners and actually setting the agenda, more than that.
Thank you so much for that framing, and thank you for including the Inter-American Development Bank in this important discussion. It's a topic very close to our hearts, as I know it is for all of the multilateral development banks. Just to pick up very quickly on the point that you sort of opened up, we know that the G20 has been pushing the multilateral development banks to sort of come closer together, work more as a system, to formulate these types of platforms. But exactly what that means, a term can kind of mean anything, has been left a little bit to the MDBs to figure out themselves. The MDB heads, with President Calvino and the other heads of the MDBs over the course of this last year, have gathered together. And one of the 16 deliverables that we put together in the viewpoint note that the MDBs themselves have prioritized for delivery is a platform that captures what we were just hearing from Belgium and what the president mentioned herself, which is country ownership. It's not about the MDBs going off into a corner and figuring out how we are going to co-finance, parallel finance, put together our procurement systems or otherwise come together. It's about making sure that the countries are articulating their priorities and that we are finding a way to work together efficiently and effectively under that framework. And the second thing, which President Calvino made a brief reference to, I just wanted to kind of put a fine point on, is focus. I think that having a focus like primary care is much more practicable than attempting to do everything everywhere all at once. So everything is nothing, as we know. It's very difficult to imagine that every development challenge is going to be covered with all MDBs working together in every emerging market and developing economy. Whereas when we talk about energy transition, we talk about climate finance, we talk about public health, particularly primary care, that's something that we can kind of identify and envision what the outcomes would be. So I think that those are the two points that we wanted to emphasize. We, as you mentioned, with PAHO, which is the World Health Organization's office, regional office for Latin America and the Caribbean, and with the World Bank, we've set out our own version of this platform called the Alliance for Primary Healthcare. But basically, it's the same principles, and it's an attempt to bring the resources, the technical support, and the country's leadership together with the UN agencies and the primary multilateral development banks working in the region.
Thank you, Jordan, and thank you for being so concise. I think we will have to be really concise because we've got a few more people to hear from. Thomas Ostros, we can always rely on you to be concise, being a Scandinavian, but also give us a sense that, is it true that this platform is going to help us? Have we maybe, have we not been doing it quite well enough? Can we do it better?
People have already mentioned the profound experience that COVID was, not only for populations all over the world, but also for us multilateral development banks. And we must learn some lessons from that. And one is that the partnerships becomes extremely important going forward. With the private sector, we finance high-tech, innovative life science and biotech companies. And that became very important during COVID, since we also financed BioNTech, that made it possible for them to bring very quickly up a vaccine against COVID. But also distribution, cooperating with COVAX and Gavi to see to that as quickly as possible distribute this vaccine. Cooperation with Senegal, Institut de Pasteur, which was a very interesting way of seeing that this knowledge is acquired and developed in Africa, also in Rwanda with vaccine production. So that, I think, was one profound lesson. But also we saw the weaknesses that we knew, but we saw it so strikingly in primary healthcare and how that hinders an effective response. And I think the ministers from Uganda and Senegal very clearly spoke about that. And there the cooperation with WHO becomes so important. WHO is for us a very important partner. We partner up with Eradicate Polio campaign, 500 million euros, and now in financing primary healthcare. And to use your expertise to create credible investment plans together with partner countries, I think will be very, very important. And to make it bankable for us, to take the decisions, to see to that the resources flow into that. So I really look forward to that work going forward.
Thank you so much. Maybe we are, Heidi, learning some lessons after all. From the Asian Development Bank, you gave your endorsement to this platform recently. Why? Why did you do that? Why do you think that's going to support your work?
Development Bank is, taking care of health solution in the Asia and the Pacific. And we, after having, careful consideration that we support the Declaration on Health Impact Investment Program for having stronger primary health care and the health system resilience. With our own interest, we confirm that, this endorsement is necessary to provide the support necessary for the Asia and the Pacific countries. Let me little bit highlight on how we are working with the health solution in the region we are covering. We are working to scale up health investments, enhance financial protection against health risk, and ensure excellent health services. Again, the health sector must support to promote the climate action, private sector development, regional cooperation, and public health, and digital transformation, resilience, and empowerment. And here comes the country platform, here comes the country ownership. And this will be, much easier if we work under a platform. Again, we have an example how this catalytic funding with MDBs, how it is supporting our member countries. One good example is together with MDBs, we invested, I think 4 MDBs is Asian Infrastructure Investment Bank, Islamic Development Bank, and the World Bank and ADB. We invested in Indonesia, and the support is around $4 billion. It increased the domestic financing to address the critical gaps and the disparity in primary health care, public health laboratories, and referral hospitals. And this ensured universal health access and quality health services. In the Indonesia, it ensured improved health system resilience. So for one member of MDBs, it may not be possible. $4 billion is a lot of money, but we work jointly under a platform, under co-financing, under parallel financing that help us to serve in the ensuring universal health coverage in Indonesia. Okay.
Thank you for that. And I think that you touched on a very important point, which is the catalytic power of the MDBs, which is absolutely it. I'm going to turn to the Islamic Development Bank, which, of course, was one of the founder members of this platform. And we're very happy to have Dr. Issa Faye, Director General of Global Practice and Partnerships. Give us a sense, would you, Dr. Faye, of how the Islamic Development Bank could, and now you're with us at the EIB and African Development Bank, how you feel this platform could actually support what you're doing.
It is working now?
I think it's fine.
Yeah. Thank you very much for giving me the floor. I just wanted to recognize from the onset that the Islamic Development Bank is a founding partner of this initiative. We have been, since the beginning, a key member of this, and then we have been glad to host the whole team in Riyadh last April to work on the governance and the structure, so we're very happy to be here and to contribute. Before coming to your responding to your question, just a couple of things to put in perspective. The Islamic Development Bank has health intervention as part of our DNA. It has been a critical aspect of our interventions around health and supporting the primary health care. For example, I think that in the aftermath of COVID, we have been one of the first to support Institut Pasteur de Dakar to start the vaccination, and we have been following. Last week, I was with them last week actually to try to see how we can expand and help them going forward. So this is critical to our work, and we'll continue doing that. Now, to answer your question, I think as a partner, I will try to tell people who are in the room why this is valuable, why this platform is important. I think I have three main answers to that. Why it's important. One, I think that this platform will help us harness data and evidence to make sure that we have evidence-based decision-making in terms of processing projects. And this means that we're going to have not only data, but system in place to try to make sure that we steer the financing where it's most needed. People have talked about the demand is enormous. The challenges are enormous. How are we going to make sure that the money goes where it's most needed? We're going to use data and system to make sure that every intervention is targeted. So that's one thing, though evidence-based, and Madam Minister, you're totally right. We need to have an impact system and a monitoring system. It should be end-to-end. It should not be an afterthought. It should be with us so that we can tell the impact narrative. Because at the end of the day, we are doing this for impact. We're not doing this just to have another fund. We need to make sure that all the interventions are impactful, and we can document for accountability and transparency. So that's the first thing that we want to do within this platform. The second thing that we want to do is responding to Madam Minister and my colleagues. I mean, yesterday we were in a panel discussing the multilateralism and the reforms. And then somebody mentioned the viewpoint that we have as MDBs. We are now working much better. We are more agile, we are leaner, and we are trying to foster collaboration and harmonization. And this is what this platform will help you do as well. This platform will help you pool resources, harmonize resources, and also partnership and risk-sharing mechanism. We're going to build in a risk-sharing mechanism in such a way that some of the institutions that will be in the platform will help us de-risk the transaction that we're going to have. And last but not least, I'm mindful of time, is that it's not going to stay here in these 5 institutions. We want to broaden it. We want to bring the private sector. That's where we're going to scale. If we don't have the private sector, forget it. It's going to be an MDB circle. We're going to run around, and we're not going to deliver. The private sector will have to come in. We need to crowd in the private sector big time and make sure, how are we going to do that? We need to bring in the philanthropies as well, because what we need is concessional money. It's not just hard-cut money. We need concessional and grants to be able to deliver on the ground. So to do that, we'll have to be accountable, like Madam Minister said. We need to make sure that there is transparency, and then we can report. We need to make sure that our impact narrative is strong enough to bring in those private people coming in. Impact investing is a network that have to join us to make sure that we can deliver. Public-private partnership is another element that we have not talked about, but I believe that if we de-risk, that will help us maximize impact. So those are 3 type of values, proposition, I think that I hope we will get more people joining us into this endeavor, because this is going to be very impactful and affecting lives. Thank you very much.
Thank you very much. I appreciate those comments and the conciseness. Now, I'm going to go to the last part of our discussion, and before we do our signature, very happy to welcome Anton Leis Garcia. Thank you for joining us from the Spanish government International Development Department, the agency, I think is the correct word, and also from the U.S. Finance Corporation. We've got Nafisa Jiwani. I'm going to ask you both of you just to widen out as we sort of come to the end of the discussion again, the value of the WHO being sustainably financed, the importance of that to the health ecosystem, and maybe also when I come to you, Nafisa, do feel free to give us a little bit of an insight, but a short one, on the important announcement you're making on surge financing this week as well. But maybe I can ask you, Anton, to kick us off. Where do you see that value and as part of this platform we're talking about, but also more broadly?
Well, thank you very much, and thank you for this timely initiative. The pandemic happened 2 years ago, and we see 4 years ago. Yeah, well, we ended the pandemic 2 years ago, and it seems we have forgotten. And frankly, I think there is a risk of losing the momentum on global health on many fronts. So this is very timely. I think the messages that have been sent from NDBs in this room consistently on working together on many topics, in this particular one, are actually very, very welcome. Health is a top priority for Spain. I think this is one of the things that we can export. And I think when we talk to partner countries, I'm sitting next to Mozambique, for instance, many others, Senegal, this is something that we hear. They want to learn about our primary care system. So we see our work as exporting that. About two-thirds of what we do is multilateral in health. We support many of these global health initiatives, and I think this is an area, compared to other sectors where we work, where we are not short of multilateral initiatives. They are very effective. There is a lot of innovative financing. What we need is to connect the dots, and I think that's where the WHO can really make a difference. First of all, it can identify which areas, which priorities are most important and need financing. Primary care is absolutely fundamental because that's actually where the equity access problems are and where we see more of the market failures in terms of the financing. So by de-risking, by leveraging additional support, the MDBs can come in. The other thing is this is a multi-actor. It will avoid this fragmentation to some extent that we are seeing and Heidi was referring to. Primary care, I cannot stress it enough. It is crucial for universal health coverage. We are not making enough progress there. We are supporting bilaterally, many of us, national health systems. We really need to connect these multilateral initiatives, these vertical funds, with support for the systemic approach. If you look at the countries that have fared better in fighting the pandemic are those that have strong primary care systems. And I think that's actually where probably the money is less at the moment. So we really welcome that, and we really support the WHO. We are increasing our financing for WHO this year by 10%. WHO is also attracting attention to emerging priorities, climate, for instance, or the impact of climate on health systems. So we need a strong WHO governing the system. Congratulations, by the way, on the international health regulations. That's an important step. Hopefully soon a pandemic treaty. But we also need WHO, pointing where these investments can be most effective, and all of us, the MDBs, but also bilaterals following.
Thank you so much. Thank you for that. And we're very happy to have you here from the U.S. Development Finance Corporation, Nafisa. And I know, as I said earlier, you're going to be announcing this initiative, but give us a sense of to what extent you think this kind of initiative that we've been talking about, a sustainably financed WHO, is going to contribute to what you want at the DFC as well. And then we're going to go to the signature. So we would ask colleagues to get ready with the papers because we're going to go to the end of the room with them, and then we will hit our timing just right. Over to you.
One, I would like to say that the largest challenge that I saw during the pandemic is not that we didn't have money. It's not that we didn't have financing. We just were not fast. We weren't fast. We weren't coordinated. We didn't work together to make sure that there was financing where it needed to go. When WHO was making investments, the banks were making different investments. That's a problem. So tomorrow, we are announcing the Surge Financing Initiative, which is a G7 initiative where the G7 DFIs, EIB and IFC are working together to ensure that we're making strategic investments as it relates to surge financing for actually 3 areas. One is procurement, production, and then for delivery of medical countermeasures. This includes vaccines, therapeutics, and diagnostics. We have to be creative. We need to be much quicker than we were before. I'm happy to say that we've already leveraged this initiative for MPOX. In fact, when it was announced that MPOX was a PHIC, immediately the DFIs were already on a call with WHO, Africa CDC, Gavi, and CEPI to say, what are the financing gaps and how do we address them? The U.S. government has invested $3.1 billion since 2020. So not a small number. We start off at 200 million. So are there private sector investments that we can do? 100%. That shows you scale and scope. Our investments include anything from health system resiliency, so healthcare delivery and services. We've invested in Senegal as well. We really believe in Senegal being a partner of the United States government. We've invested in Aspen Pharmacare in South Africa as well, and we hope to continue these investments alongside with partners like WHO.
Thank you. We really have a sense of a common purpose in this room. I think it's fantastic. And on that note, I'm going to invite Dr. Tedros and President Calvino to sign what is actually the first contribution agreement to the platform, one of many we hope, very much dedicated towards supporting the countries to frame their first investment plans. We're going to go over there. Okay. So while we're setting that up, never mind. The most important thing is that the platform works. So let's just move a few of these bottles so we have a nice photo. I will get out of the way. So for those of you in the room, what we're signing is a 10 million contribution agreement from the European Investment Bank, obviously under the auspices of the WHO for this platform. Soon to be followed by the African Development Bank, I believe, and the Islamics. And let me just say thank you to all of you in the room. It's been a wonderfully rich conversation. I think hugely reassuring and uplifting. We are really making progress with great concrete solutions. So thank you to all of you and look forward to seeing you all soon. Bang on time. Bang on time.